This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about the causes of wrist pain. So you may be watching this video if you have wrist pain and are just curious what's going on. So when I think about wrist pain, I group it into three different areas. They call it the ulnar aspect, which is near this ulnar bone or near the pinky, the center, and then towards the thumb or the radial side. So what can be the causes of pain in each? So if we start with this pinky sided, if you have pain here, it can be one of a couple things commonly occurred. There's a piece of cartilage here called a triangular fibrocartilage complex, and sometimes if you kind of jam your wrist, it'll kind of tear a little bit of cartilage in there, and that can sometimes be pinpoint pain right here, or pain when you grind it. Something that can also cause pain in that area is something called extensor carpi ulnaris, or ECU tendonitis. So there's a tendon that runs right up along the side there, and that can hurt sometimes if you do this sort of movement or something like that. And it can be very subtle to differentiate from TFCC because the ECU tendon makes up part of the TFCC. So there's a good test called the ECU synergy test where you hold your hand up like this and you try to spread apart your middle and thumb fingers, and if you get pain there, then it's more likely to be ECU tendonitis and not a TFCC injury. I know it's a lot of acronyms, it gets complicated. So those are the main causes of pain on the ulnar aspect or pinky side of your wrist. There's a lot of other weird things with the wrist, but by and large, it's mostly those two things. If you go to the other part of the wrist, the radial side or the thumb side, there's a few common things. One is that there's a couple tendons that run through kind of to the base of your thumb, and you can get tendonitis. So those tendons, it's called de Quervain tendonitis, and that'll be pain right if you tuck your thumb inside your fingers and put your wrist down, it'll be like pain right here. That's very classic for it. Or sometimes if someone's older, they can get arthritis at the base of the thumb, and you'll have thumb basilar joint arthritis. Or rarely, if someone gets a trigger finger in the thumb, it can kind of present weird. Trigger fingers can present all sorts of weird ways and cause pain in that area. But for radial wrist pain, that's mostly what it is. For central wrist pain, it gets a little bit more complicated. If you have arthritis of the wrist joint, or if you tear one of the big wrist ligaments, like the SL ligament, scapholunate ligament, that'll cause pain in the back of the wrist. That's more of like wrist joint issues and less kind of tendinous things going on. There's all sorts of pathologies that can happen when you tear that ligament a long time ago, and then you can get arthritis as things go on. So generally speaking, that's kind of what center of the wrist is. However, if you've had a recent fall and you didn't break your wrist and it hurts back there, sometimes that's also the site of a wrist sprain or strain. So you can get pain there as well. That usually wraps up most of the wrist pain that most people get. Like I said, there's a bunch of weird oddities and strange things that happen, which I'm not going to talk about because this covers about at least 90% of it. So I hope I was able to answer your questions about what causes wrist pain. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but note that I can't respond to your specific medical condition or what you should do specifically. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.